Good morning, everyone. I'm Sarah Krevans. I'm the president and CEO of Sutter Health, and I am so delighted that you've taken your time to join us today for this important topic, for us to be able to talk about mental health, talk about mental health care, talk about mental illness and mental well-being. I can't imagine a more important time to be doing this. I'm sure that you have a lot of demands on your time. And as we focus on mental health in the light of what we're facing here in California, the pandemic, the economic situation, social justice and discrimination, and now once again the wildfires that are devastating us across California. I think that it's important to remember that we've had people among us, as a matter of fact, almost 73% of Californians have reported in the last several weeks feeling signs of mental health systems. But at any time in our country, depending on what study you read, 1 in 4 to 1 in 5 individuals is suffering from a mental illness. And unfortunately, our healthcare system overall, our insurance system, and our societal support for mental health and mental illness is not always as good as it is for other aspects of healthcare. And I'm so excited that here today we have joining us Mayor Darrell Steinberg and Lenny Mendonca, and I will introduce them in a minute, to talk to us about their experience and their passion with mental health care. And more importantly, I think, to discuss with you and with all of us, what can you as employers, what can you as people do to improve the mental health for your friends, for your colleagues, for your coworkers. Before I introduce our panelists, I do want to let you know that after some opening remarks from them, as well as some questions that I have for them, we're going to be taking your questions. And so at any time during the broadcast, please feel free to type your questions into the Q&A box, and we will be getting to those questions at the end of the broadcast. So let me start by introducing our Sacramento Mayor, Mayor Darrell Steinberg. I've been honored to know Darrell for a long time, and in the entire time that I have known him in so many different roles, he has been a champion for expanding and improving mental health care services. In the state legislature, he passed numerous bills to support mental health programs. He authored and led the campaign for Prop 63. And in 2015, he founded the Steinberg Institute, which our organization is proud to partner with, which works to raise the profile of high quality mental health care as a critical public policy and healthcare issue. Also joining us today is Lenny Mendonca, the former Chief Economic and Business Advisor to Governor Gavin Newsom, and also the former chair of the California High-Speed Rail Authority. He's a senior partner emeritus from McKinsey & Company and the former chair of the Bay Area Council. In July, Lenny authored a powerful and very poignant essay in Cal Matters, talking about his own struggles with mental health, and I think really has been a role model in terms of what does it look like and how can we as executives speak up about our own and our families and our friends and our coworkers' experiences. And I believe that Lenny's courage is actually going to change the face of mental health care here in California, and I'm very grateful. So please join me in welcoming both of them, and I'd like to transition to a few questions for them. So Mayor Steinberg, Darrell, I'd like to start with you. Tell us a little bit about what sparked your passion in mental health care and why it's particularly important to you.
Well, first of all, let me thank you. Oh, am I muted or am I on?
No, you're on.
Okay, good.
You're on?
Yes, can you hear me?
Yes.
Okay, good. First of all, Sarah, thank you so much for hosting this along with the Bay Area Council. I've had the privilege to work with both you and the Bay Area Council for now many, many decades. And it is also an honor to be with Lenny today. And I know he will talk about his own story, but let me just start by saying two things. 20 years ago, over 20 years ago, when I started on this cause, I do not believe that the Bay Area Council or other major business organization would have held a forum like this. That's how thick the stigma was back in the day. And I don't know whether Lenny or people like Lenny would have had the ability. He certainly showed tremendous courage to tell his story 20 years ago today. As much as we will talk about the challenges of our multiple systems and what still remains broken, I do think it is important to recognize from the outset that we have made tremendous progress and that we still have a long ways to go on the public policy side, on the system side, on the attitude and stigma side. And yet we are here today talking about a subject that was not talked about just 20 years ago. How did I get involved and engaged in this? It actually was not a personal experience, although in an ironic way, after I became a mental health advocate, my family was touched by mental illness, which makes the point that this is not about the other, this is about all of us. It's about those we love, it's about ourselves, it's about people we work with and people that we know. For me in college, I attended Berkeley and Go Bears and UC Davis, and in both of my university experiences, I had some very moving interactions and friendships with people with physical disabilities. And I saw that the flip side of disability is ability. And I've had a lifelong interest in working towards equal access and equal opportunity on the disability side. And so when I became a younger elected official and homelessness was a major problem in my city back in the 90s, still is today, unfortunately, I recognized at the time that the underlying cause of so much of that increase in homelessness was the fact that decades earlier, the state had made a well-intended public policy decision to shut state mental hospitals, promised a decent system of community-based care and promised it would fund that system, and then never followed through. Yeah. And here we are. And I decided as a young assembly member, given some good advice, that pick a couple topics that no one else is working on, where you can put your own skill and passion into and make a change, take something on. And I chose mental health and never look back because it has been rich and very, very important.
Yeah, and I think you and I have talked about, we had similar experiences. When I was 20 years old and had dropped out of college, I worked in a long-term care facility that had been opened after the deinstitutionalization movement swept the country. And so yes, those individuals who lived their lives, this was in Massachusetts Mental Hospital and the state home for the developmentally delayed, they were then warehoused in a long-term care facility with a 20-year-old college dropout as their caregiver. And it was that gave me my lifelong interest in mental health. And then, like you, Darrell, I've had lots of lived experiences with family, friends, and loved ones. And I'm fortunate enough now to be in a position where I feel that I and my colleagues at Sutter Health and other parts of the healthcare system can actually make a difference in improving things. And you acknowledged we've come a long way. I know you've helped to lead a campaign against stigmatization of mental illness and really respecting and understanding mental illness. And I'd like now to turn to you, Lenny, and I mentioned the commentary that you had written. And you mentioned in that commentary that many people advised you not to write it and not to share your illness. Why do you think they did that? And why is acknowledging this still such a challenge?
Well, first of all, thank you as well for moderating this conversation, Sarah, and engaging in it. And thank you, Mayor Steinberg, for your longstanding commitment and difference you're making on this really important topic. And I'm delighted that the Bay Area Council is hosting this conversation and had such substantial interest in it from the business community. My experience with this topic is not as a longstanding expert or engaged. It's my experience is N equals one, and that one is me. And as part of that experience, I was starting to, after having gone dark for 6 weeks, to tell people what happened. And actually, it was my family who encouraged me to write something down and think about sending that around to people before I called them so that they'd have a little bit of context about what we're going to be talking about. And then when I wrote it and started sending it to a few friends, I got some encouragement and aggressively encouraged by my daughters to publish it. And I also had several people, really well-meaning, long-standing friends, mentors say, don't publish this. It will ensure that you're forever known as that person. And it's something that you should just keep to yourself. And if it's important, raise it, but otherwise don't talk about it. I said, thank you, but it just emboldened me even more. It just felt like exactly the wrong advice. As I mentioned in the article, when I broke my leg mountain biking, was a very obvious physical injury, and there was rehabilitation associated with it. And if you saw me, you'd know, because I was in a cast, that something had happened. And it was a perfectly normal conversation to say, that will get better. You need to go and pay attention to it, and then you'll be back. And to me, this episode, while it was scary and frightening at the time, felt like the same kind of experience. And that if you can't have the conversation about it and encourage the kind of support and treatment that is helpful to be able to participate again, then what's wrong? And so it just emboldened me to say, why don't we continue to support the conversation that Mayor Steinberg has been so insistent on, to start with, let's destigmatize the conversation. You can't have a conversation if you can't have the conversation.
Yeah. And it's really a fascinating thing. I had a similar experience in my family. My husband had a tremendously spectacular bicycle accident, had 2 spinal fractures. And of course, the casseroles start arriving. People are driving your kids to school. Everybody wants to help. Everybody knows about it. And the support pours in. But that same support doesn't pour in necessarily for families affected by mental illness. It doesn't pour in sometimes because of they don't share, but sometimes even when they do share, people don't know how to help, or they're afraid to help. And even that same support, can I drive your kids to school? Can I pick up your groceries, is still valuable, and yet so often it doesn't happen. And so my next question is for you, Darrell, really building on that theme. What do you think peers can do? So we have a wonderful audience here of interested business community leaders. What role can peers play in both identifying and supporting those with mental illness?
That's really an important question, because one of the great challenges we have in the traditional mental health system is that access is difficult for people for many reasons, but in part because we do not have enough providers. When you look at example for the number of child psychiatrists in some counties in California, I mean, it's single digits, even in some large counties. And that's true across the entire spectrum of the professional mental health workforce. And so the peer movement, and it is a movement, has become really powerful and profound in California. I often tell the story about my late grandmother, who in the 1970s and the 80s was housebound because of physical ailments. And she would spend some of her time with a list of phone numbers and names of other seniors who through Jewish Family Service were shut in themselves. And she would call them, and she would have long conversations with people who were lonely and shut in. And that gave her a lot of satisfaction, of course, and meaning in her life, but it also helped many others. Well, she was not a trained peer or a professional mental health worker, but she was every bit a mental health worker as anyone could be defined as such in any realm of life. And what we are finding now in 2020 is that there's nothing more powerful in terms of healing than talking to somebody with a shared experience. And so in California here, two quick examples. We've got a bill on the governor's desk because public policy is important. It is SB 803 by Senator Jim Bell that would actually provide county and federal reimbursement for peers that go through a training program and get certified as peers. This bill, is, by the way, has been a decade in the making because I introduced it back when I was in the legislature, and it's been vetoed by successive governors because of potential state costs. Well, we've dealt with that. It's now a county opt-in, and we hope the governor will sign it this year, because if we can employ thousands of peers, not only is that good for the peers who often need their own employment, but it's also obviously an effective way to provide support for people who are in the midst of their own challenges and crises. The second thing that I want to say to employers is that there's also an emerging movement around specific industries starting their own peer support programs. Here in Sacramento, we have a restaurateur by the name of Patrick Mulvaney that has started a program among 12 restaurants in Sacramento called We've Got Your Back. And they are working with our institute and with some of the health providers. I believe Sutter is involved as well, and thank you, Sarah, to train those who want to step forward in the restaurant industries and how to recognize the signs and symptoms of depression or anxiety or even mood disorders in their fellow employees. And they set up a program where every day when an employee comes to work, they can anonymously submit a card that describes their mood. And then the trainer, a peer, takes the cards, reads them all anonymously, again, gathers the workforce. And they spend 15 minutes at the beginning of a work shift or session to actually talk through what people are feeling. And for those who want and need more intensive help, they then have a referral network. This, to me, has incredible potential. The construction industry is starting the same in Sacramento. Imagine if we had these kinds of organized peer networks in every employment sector in our society. How many people could get the support and or the referral for help much more easily than having to hide whatever they're feeling when they come to work?
Yeah. And I'm going to ask Lenny a follow-up question about that. But before I do that, if I could just remind all of our colleagues participating in this Zoom conference to please at any time just type any of your questions that you have for any of us into the Q&A box, and we will be setting aside time for those questions at the end of this. So Lenny, let me follow up on that. When I think about the pressure and the stress that your job was before the pandemic, and then I think about being an economic and business advisor when all of this hit. It just was, it must have been, really a kind of incredible. So I have a couple questions, maybe a two-part question. One is, when you wrote that essay and you talked about that stress and then going back into that environment, was there something you were hoping that maybe work environments would do in a response to that? Is there something that you had hoped would happen in a response to writing that essay? And are there things you think could be done in high stress environments to help people cope in different ways?
Um, the answer to both of those is yes. I certainly affirm and endorse and enthusiastically encourage the peer support that Mayor Steinberg talked about, at least from my own experience. And again, it's my experience. It may not be indicative, but I had no idea what was going on when I first experienced some severe symptoms of anxiety and depression. And if I had not had people around me who were aware and encouraged getting some assistance, I wouldn't have known what to do. And so being able to have others who are paying attention to your own situation and who have an ability to encourage support is really helpful. And today, when many people are, that experience is virtual in things like what we're doing now, as opposed to being day to day in the workforce, it's even more difficult if you don't have ongoing encounters. But I do think in the workforce, being able, and it's part of why I decided to write this, was to encourage people to ask or to enable the conversation with their colleagues, and particularly people senior in organizations, to be able to say, this is a totally appropriate and necessary conversation to have. And whether it's in a restaurant workforce, as the mayor said, with peers, or whether it's part of a senior team, being able to say, in the normal circumstances, stress and anxiety and hard work can be challenging, and you throw on top of where we are right now, it's overwhelming. Whether you're a government official, a senior executive, a restaurant worker, a mother, a teacher, this is challenging, and we should be talking about that. And if you just start discussions with, we're going to have a little bit of a how are we all doing conversation that isn't everything's great, it's really, really invigorating and freedom generating to be able to have that. And what I discovered through interactions that I had from when I wrote this is extraordinarily common and not talked about.
Yeah,
And so
it is.
being able to say, let's have the conversation in whatever setting you're in is really, really helpful. And a lot of us spend a lot of time in work settings, and that's got to be part of the conversation.
Yeah, I love hearing that, and I really agree with that. And I would say, I think we're all learning together, and maybe not at the very beginning of the journey, but we're certainly not even in the middle of it in terms of learning what to do. Just to throw out a couple ideas to businesses who may be thinking about it. One of the things that we did is we actually have trained 1,500 managers on first sort of reducing some of the misconceptions about mental health and mental illness, because that then opens up their minds to that they could do something about that. And then also we've partnered with an organization called Living Works to actually start doing training around what are ways that you can safely intervene if you think a coworker is at risk. If I think of us as a healthcare setting, right? We have whole classes of employees who are trained in advanced life support, whole classes of employees who are trained in basic life support. But nowhere were we doing training in some of the basics of mental health. How do you even have a conversation if you think somebody is in a place where they need some assistance? And so I think there are things, and sometimes, even as a healthcare organization, we needed some outside assistance in looking at that. So we have lots and lots of questions coming in, which is just wonderful. Really, really happy to see that. Before I open it up for questions from the audience, let me just give each of you a chance. Maybe share your wish list with this group. So I know, Mayor Steinberg, you've probably got a wish list around both what would happen overall in our society around mental health, but maybe some specifics around public policy. You mentioned one of them. And I'm really curious, Lenny, what your wish list might be. What are the 2 or 3 things that you think really could happen that would improve things? And particularly, what are those things that you think our business colleagues on this conference could do? And let's start with you this time, Lenny. What would be on your wish list that you would hope people would go home and think about after listening to this?
Again, with the caveat that I'm offering advice on a topic that I have recent and relatively limited experience with, the reaction to the article I wrote was indicative, to me at least. I've probably written 75 or 100 editorials in my life. I got an order of magnitude more response from this one. And the responses were much more from people who were telling a personal story that was similar to mine. And unfortunately, many of them not being great outcomes. And so it was a surprising response to say, thank you for allowing this conversation to happen. I wish people had had it before, so we could have done something or engaged in this before. So that my first and foremost, by far, advice is to whatever setting you're in, to engage the conversation. We have to have this as a legitimate and important topic around health and well-being. And in whatever organization you're in, be able, particularly if you're a senior leader, to show that that's appropriate and having a genuine and sincere conversation of interest. And if it takes more senior people to talk about personal experiences to do that, I'm all for it. But whatever it takes is, let's have the conversation. And then the second thing I think is, support is for care has to be part of the pillars of healthcare. This can't be something that is a sidelight that if you happen, as I was fortunate enough to have great health coverage and access, you get the kind of care you need. And that feeling like it is a function of privilege or luck is just not acceptable. We can't have the kind of response to the nature of the challenges that we're facing in our society if mental health isn't treated with the same discipline, sincerity, coverage, and support that is needed. So I don't know how exactly to do that, but I do think employers as big voices in the healthcare conversation can do at least those two things. Have the conversation in your workforces and ensure that really high quality coverage for mental health issues is part of your offering to your workforce.
Yeah, and it is really a big challenge, and even individuals with mental health coverage who have insurance in many communities in California, it can be very hard to find providers who take insurance, and people will end up on long waiting lists or paying out of pocket, or they may see somebody who doesn't specialize in their particular underlying condition because there's not enough information for them. So I really echo wish list.
Well, thank you for giving me the next 90 minutes to describe. Three things. One is parochial. Sutter has graciously endowed our institute, our advocacy at the state capitol. I would love Lenny and at least one representative of the Bay Area Council to join our board, because we are galvanizing the issue in Sacramento as much or more as any other organization. And we could use your leadership, your voice, and your engagement. But I want to get to the real core of it. I'm as you know, people who know me, I'm definitely a glass half full guy. And I do think it is important we recognize the progress. The Mental Health Services Act generates $2.4 billion a year. It's helping tens of thousands of people, and I'm grateful for that. And yet, if we're real honest about it, the mental health system is still broken. It is still broken. And here's why. If I were to summarize why, and again, it is a longer discussion. I know we have limited time. When you talk about the mental health system in California, we literally have 4 separate systems. that don't talk to one another. You've got commercial packages spotty. Not only is it a matter of not enough access because of the lack of professional support in a lot of parts of the state, but frankly, the insurance industry still treats mental health different than physical health. And we've got a bill on the governor's desk, SB 855, that would seek to tighten the parity law, and it is essential that that bill gets signed. We've got commercial pay. We've got Medicaid, which is public managed care. We've got prisons and jails, which unfortunately are mental health systems in their own right. And then we have the public system, the Prop 63, the Mental Health Services Act, which I believe leads when it comes to innovation and prevention and early intervention. The problem is that we don't have a single integrated system. And depending upon what you qualify for or don't qualify for, you may or may not get what you need. In fact, the stories are pretty legendary now, that if you have a loved one in crisis or you're in crisis and you don't have connections, the best way to get wraparound services or the best way to get any kind of preventative care is to lose your commercial insurance policy and find a way to qualify for Medicaid or one of the public systems like the Mental Health Services Act. And then the Mental Health Services Act gets criticized, and some of it's justified criticism, for not having enough reach and being able to serve as many people, when in fact a huge cost shift is occurring because those who can't afford commercial pay or those who aren't covered on the Medicaid or commercial pay side resort to the overtaxed public system. And so we need a single integrated system of mental health care where it doesn't matter what front door you walk into, you know that there's going to be a standard of care and a series of covered services without having to go through the back and forth. I mean, if you give me just another minute, you know, I have a friend now who is dealing with his insurance company. It's one of the carved out mental health specialty plans. A 15-year-old daughter with anorexia. And she's in residential treatment. And every time she gains a little weight in the residential treatment program, they step her down because now she's, quote, better, even though it's a mental health issue. The minute they step her down, she loses weight again, and they've got to put her back in the residential treatment because it wasn't long enough. And the argument is that, well, we're covering her because we're dealing with her physical condition. SB 855, the parity bill I talked about, would cover eating disorders as one example. We need one integrated system. Here's the third thing. We have in the mental health world a stage 4 system of treatment and care. And we can all relate to the differences between stage 1 and stage 4 because it used to be, when it came to cancer, that we had a stage 4 system. And now because of research and attention and priority, many cancers, of course, detected early, can be treated at stage 1 or stage 2, and people can live longer lives and or full lives. With mental health, we don't fund, except through some specialty programs through the Mental Health Services Act, prevention and early intervention. We don't. There are pilot projects around early psychosis identification and intervention for teenagers. We have some funded school-based mental health services, but they are not well funded. And we need to push all of our systems, our 4 systems, to cover and to focus more on early intervention so that people don't suffer the terrible consequences of finding themselves in jail or on the streets or broken up from their family forever because of something they may have done because they didn't get the help and treatment early. So this is a lifelong journey here on the advocacy side. And we're in the midst of it, and the employer community and the Bay Area Council to make mental health a priority like you're doing today would send a very powerful signal to policymakers that we and you demand better.
Great. All right, thank you. Well, I'm thrilled that we have so many questions and comments coming in. And I apologize to anyone in the audience if they have typed in a question and we don't get to yours. But the Bay Area Council is here. They also know how to get you resources and information. So I may pick some that are more thematic if we don't get to your individual one. Again, my apologies. So the first one I'm going to be giving to you, Darrell, starts out as a thank you. Thank you for attending this Zoom conference, and thank you for helping to bring Major League Soccer to Sacramento. How do you foresee health systems, and I'm going to take this beyond Sacramento, would ask specifically about Sacramento. How do you see health systems, the government and sports teams working together to address mental health issues? Do you think there's a way that we can bring resources that may have the ability to reach or to galvanize people's hearts and minds, like sports teams, into the discussion of mental health?
Absolutely. And you're already seeing it in some of the professional leagues where some of the stars are coming out and talking about their own struggles. And there are a few things more powerful, as the response to Lenny's story shows. People revealing themselves in ways that make others know and feel that they are not alone. And when it comes from role models, public figures, celebrities that kids especially can relate to, it is an incredibly important tool to break open that stigma, which has improved, but still is way too thick. And so, yes, we have funded over the course of 15 years a number of anti-stigma campaigns through the Mental Health Services Act. And I think we need to go the next level here. But, the public information and education needs to go beyond "you shouldn't be afraid." It also needs to give the people watching and listening the tools and the referrals to be able to know where to get the help. It's one thing to know, to say, okay, I'm willing to get help or seek help. But it's another thing to actually know how to easily access help without the frustration that so many people experiencing trying to, again, navigate these complicated systems.
Yeah, and we have a couple of comments. One of the both comments and a question that's in our question and answer is this question about, mental health services need to be individualized, and sometimes people need a personal connection. And how can public services provide these at the kind of scale that is needed? And let me just add a little bit about what we know about what's happening with the supply of mental health professionals in California and this country, and then also offer some bright spots, because it's really easy on this topic to always be discouraged. So one is, my personal view is that the solution is not going to be a single system. So it's not going to all be in the public system. That mental health care needs to be recognized as an important part of healthcare, and I think that's been a challenge. And I think that we need all of healthcare to embrace mental health care as a legitimate part. And primary care physicians and primary care providers like nurse practitioners, physicians assistants, they are on the front lines and actually do so much of the initial screening and diagnosis of mental health care. One of their challenges is what happens after that initial diagnosis. And are there specialists? Are there resources to send to We were talking, the panelists and I, before this started, that one of the silver linings in what has been an incredibly difficult time during this pandemic has been the unbelievable increase in the use of telemedicine and telehealth. And that has been really true in mental health. And telehealth has made mental health services available to many individuals who either didn't have it available geographically, or who might not have felt, for privacy reasons or other reasons, that they wanted to go in to a physical location to get mental health services. And so I think that the solution for the future is going to be a combination of in-person services, telemedicine services, and there are actually some really interesting things that have been going on, particularly for adolescents, using avatars and other kinds of media that may be more comfortable for some adolescents in terms of some aspects of mental health. Not for every disease, you know, mental health is not a singular diagnosis, and so, you know, no one size fits all answer is gonna be enough there. So let me go to another question. So this is a question about what can we do about the fact that there's just a lot of confusion still about what it is that the state provides and the image of that state. This is from John Grubb. Can you talk a little bit about the state board and care facilities? There was a campaign against them many, many years ago with, you know, sort of an image of outdated buildings that looked like prisons with electric shock treatment. Much has changed. What do you think, Darrell, about the state board and care facilities? And do you think they should be expanded? Do you think they're serving a need? You know, what is happening with them from your perspective?
For people living with severe mental illness who are either homeless or at risk of homelessness, community-based board and care homes are a crucial part of the safety net. And frankly, over the last number of years, we have seen a significant reduction in the number of those kinds of homes. I'm not sure if the question is seeking to get at whether or not we should be reopening state mental hospitals again. I get that question a lot when people see the numbers of people on the streets, the increasing homeless problem, and people who obviously are not well. They ask that question, and it's a reasonable one, and here's my view. We will never go back to state hospitals, nor should we, because those were cruel, in many instances, places for people to live, when with the right combination of supportive housing and wraparound services and appropriate medication, that people can live with various degrees of independence in our community. But it gets back to that promise from decades ago. The promise that we would fund a decent system of community mental health. And despite Prop 63, despite some of the advances, we do not have enough supportive housing. And we have a disjointed system, as I've said earlier, public and private, and not enough resources to be able to support the numbers of people in need. So I believe that we need to invest in more community-based board and care kinds of facilities so that people can live in the community. And then finally, it wasn't a direct part of the question, but this comes up a lot. People ask, should we be strengthening the involuntary treatment and commitment laws around mental health and mental illness? And this is the chicken and egg question. You cannot strengthen those laws without providing the network of supports and services and have the change in law be successful. On the other hand, the fact that the law says if you are gravely disabled, you can be required to come indoors and required to receive treatment, And the fact that tens of thousands of people are by definition gravely disabled out on the streets of California, and we allow that to continue, I think speaks to the need to look at that law, to change it, but to change it in concert with adding the systems of care for the people who should not be out on the streets. Nobody should be out on the streets. And so more community-based facilities. I think we ought to relook at involuntary treatment and commitment, but not to put people in state hospitals, but to make sure that nobody is out there in the cold or the heat or the smoke. Average lifespan reduced 25 years for people out on the streets for a long time. It's not acceptable.
Great. All right. Thank you. And again, I really appreciate all of the different questions that are coming in. Lots of comments as well. I'm not going to read out all the comments, but those are there for you to see. There's one here that really speaks to me, Lenny, and I'm thinking it would speak to you, and maybe you have some advice for this colleague. How does one start a conversation with a physician if one finds oneself in a darker cloud than usual? And then there's a follow-up on when is it mental health versus counseling. But what would you suggest to someone who is thinking about how to start that conversation with their physician or another professional?
Well, in the first instance, if you have a primary care physician with whom you have a good relationship, just being open and honest about the state of your being is helpful. It does, you're often having a conversation around a particular challenge, physical challenge for seeking treatment, but being able to say, I just want to talk to you about how I'm feeling more generally can be part of the way to help the conversation. They also can be helpful in referring you to someone who can more expertly diagnose what the nature of your circumstances are. And I think that's one way. I also think there are opportunities through peer networks and employee assistance programs to be able to get referrals into the places where you can have the first level conversation around what the issue is and how to think about what are the ways you can get support and help. If that's not available, I would ask you, Sarah, where would you recommend as someone who leads a major health system for people who don't know where to go? What should they do?
Well, the first thing is, I would say reach out to someone, right? And if you don't know where to go, I think starting with your primary care physician, if you have one, is a wonderful place to start. If you don't have a primary care physician or they're not somebody that you're comfortable talking to, if you belong to a church, there are many churches there where the pastors, some of them are also pastoral counselors, but they certainly have a network of relationships. If you're really feeling in a very dark place, I would not hesitate to call a suicide prevention hotline. If necessary, to go to an emergency department, although that is not always the very best place to be if you have other places to start, but it's a place where you can go and you can be safe, and that's the most important thing to happen. I would say, and I think there are a lot of problems in our current insurance system and in the bifurcation of our insurance into mental health and physical health as if they're two separate things. But almost all of the carve-out mental health companies also do have intake lines, and they do have numbers that you can call, and they usually end up being called for information about benefits, but they also can be a source of information to help you find assistance. If your employer has an EAP program, an employee assistance program, those programs often have tremendous resources and can be a wonderful place to start. And even if those are a limited number of visits, they often can then help you with a warm handoff to something else. But, just the fact that you're willing to speak up and ask, I think is incredible. incredibly important. We have a whole series of themes of questions and comments about the mental health workforce, about the need for additional mental health providers, need for additional mental health training, the fact that peer support can be very important, that it doesn't always have to be licensed mental health professionals, but that we need many more licensed mental health professionals. And that we need to understand that some physicians don't have enough training in the diagnosis and treatment of mental health disorders. So lots of comments about how difficult it is to find care and the challenges that people have finding care and an understanding of the challenges of the supply for mental health. So let me make a comment about some of the aspects of the challenges, and then I'm interested, either Lenny or Darrell, in some of the solutions that you see. One is, I don't think this is going to be a single solution. I'm always fascinated in mental health care that often we'll treat it like it's one disease. You don't go to an oncologist for a problem with cardiovascular disease. You don't go to a cardiologist typically when you have a problem with your eyesight. You expect each of those physicians to understand enough about how the systems of the body interrelate that they know where and when you may need additional help. Your primary care physician may or may not, depending on what your relationship is with them, help you navigate that. But within mental health care, there are many different areas of expertise and many different kinds of mental illness and many different paths, I think, that we need to go down to solve the workforce challenges. And so what I would say to some of these suggestions is sort of yes, and yes. We need more effective peer support. We need more licensed clinical social workers. We need more psychologists. We need to be sure that our physicians have both the training that they need, but also that they have the time and that they're reimbursed when they take that time for mental health care. A couple things that I would point out, and I want to give a shout out to the current Surgeon General, actually the first Surgeon General for the state of California, who's a pediatrician. Her work and her passion is around adverse childhood events that cause lifelong problems in both physical and mental health, and the use of a screening tool that she's been working to have universally used by pediatricians that helps screen for these adverse childhood events. There are a number of organizations where primary care physicians and other primary care clinicians do screening for mental illness in the same way that we may screen for hypertension or diabetes. And when you think about the prevalence of anxiety, depression, other kinds of mental health conditions, it's amazing actually that people screen for other conditions more frequently than they screen for conditions of mental health. And so I think all of these things are important, and there's probably no one size fits all solution. We need the yes, and yes. And I wonder, Darrell and Lenny, if you have any additional comments about what we can do to increase the availability of mental health services.
So, do you want me to go first on that? Or?
Go ahead.
Okay. I want to answer the question maybe a tiny bit indirectly, because I think there's one other piece of this we haven't talked about, which relates to stigma and also relates to the fact that we haven't advanced as far as we must. And that is the inexactitude, that's the right word, of diagnoses, and of the lack of advanced brain science. When you look at cardiology, you put a stent when somebody has a blocked artery. It's a objective, clear procedure in many instances. With brain-based illnesses, the diagnosis is at once imperfect, and the treatments, especially the medications, are often hit and miss. The stories are legendary of people who have to go through 5, 6 or more medications before they get something that may seem right. And then it's several steps forward and maybe a step or two backwards. We have to invest more in the basic understanding of how the brain works. We may never be able to objectify some of these illnesses and diagnoses and treat them for a cure, as we do with some other more physical-based illnesses, but we've got a lot of work to do. And that's part of the stigma, because there's so much unknown that people are wary of whether or not they or their loved one can actually get better. And we need to increase that confidence so that people know that if they seek help, that they will actually feel better and do better. And many do. But the brain science, the research is vitally important to improving the system.
Now, any last comment on that, Lenny, that you would want to make?
The only other thing that I would add that I'm not sure we've talked as much about is around innovation in non-pharmaceutical interventions, telehealth enabling a much larger reach and efficient and effective use of people's time to help provide services. One of the other things that I'm getting a lot of outreach from is from people who are innovators trying to think about, are there ways that they can help solve this capacity and availability challenge with new ways of reaching people. I think it's something mental health issues are a huge productivity issue for workforces. Mm-hmm. And it would be an employer's interest to think about, are there other ways to address this issue much earlier in the process so that we can have people be able to receive the kind of support they need and get back to their lives. That to me feels like something that with the right kind of innovation and investment that the Bay Area and Silicon Valley is known for, we might be able to make some dent in those things. My personal experience with telehealth on these issues has been fantastic. Just makes it so much more accessible and convenient and timely than having to subject yourself to a long waiting time for an in-person visit, especially in today's COVID environment. I had some early exposure to a set of technologies that, as you mentioned earlier, utilize avatars or other types of mechanisms that combine technologies that are not necessarily, that are prevalent in other fields, but may not be as widespread here, that might be useful in everything from training up workforces to providing awareness and support for large employers' populations to be recognized and think about how they can engage in the conversation. So I do think that's another area where there may be ripe for investment and innovation. It doesn't necessarily have to be driven by public policy or public spending.
Great. All right. And with that, we are just about out of time. I want to thank both Mayor Darrell Steinberg, and I especially want to thank you, Lenny, for sharing your story with us and for your years of service as well to the state of California and your leadership. Do want to let you know that this is being recorded. There will be a link to the recording. The Bay Area Council staff is available to help connect you with any of the resources that we've mentioned, whether it's the One Mind Institute that works with employers, the research that's been done and the information that's available at the Steinberg Institute, or any other resources. We want to make that available to you. We know that these are really extraordinary times. We know that you as business leaders have tremendous pressure on you. We know you care about your employees and you are thinking about their well-being. You role modeling what you can do in your own well-being, thinking about the isolation and the pressure that you're under and that they're under is really important. Lots of comments about isolation, including one from a nurse that really touched my heart about how isolating these times can be, and anything you can do. Loneliness and isolation exacerbate mental illness, and anything that you can do to build those connections is tremendously important, and anything that we can do to help the Bay Area Council connect you to resources. I know I'm committed to do that. I know the Steinberg Institute will help with that. And we are very, very happy to do what we can to help those of you who took the time to come to this, or maybe some of your colleagues who could not attend. Just thrilled to see the Bay Area Council taking the leadership around mental health. So thank you. Stay well, and I just have to remind you in this time of COVID, don't forget, in addition to taking care of your mental health, to please wear your mask, social distance, practice good hygiene. You're important to California, and we want you to stay well. Thank you.
Thank you.
Thank you.